So you probably heard the term psychiatrist and the term psychologist, um, but you may not have necessarily thought about what those terms actually mean or what those people actually do. I mean, why would you unless you actually need those services? But then, the day comes when suddenly you actually do need a psychiatrist or a psychologist because you need services and you don't know which one to go for. I have people who call me as a psychologist saying they need my services, and it turns out what they actually need is a psychiatrist. So, in this video, we're going to talk about what the difference is between a psychiatrist and a psychologist and what each one does to help you kind of figure out who you should be going for. I'm Dr. Eric Newman. I'm a licensed clinical psychologist. My wife, Dana Torpy Newman, and we are Newman Psych. That's our channel. And we both work in private practice, but we decided to create this YouTube channel to kind of talk about some of our knowledge and, talk about mental health issues, both at individual and systemic levels, to help people think more about and understand more about how this system works. So I hope you like and subscribe this channel, and let's talk about what the difference is between a psychiatrist and a psychologist. So let's start with a psychiatrist. Psychiatry is a field that is like an outgrowth of neurology, and that's a medical field. So it really focuses on the treatment of mental disorders, and a psychiatrist is a medical doctor, an MD. And what a psychiatrist does primarily is prescribe medication. So if you need medication for any number of challenges, ADHD or depression, anxiety, you're probably going to go to a psychiatrist for medication. There are other providers, so other similar providers. Well, if you're working with somebody for your kids, sometimes a pediatrician, or for you, a primary care physician, will sometimes prescribe psychiatric medications if it's simple enough for them and they feel comfortable doing that. But other people, aside from a psychiatrist, would be like a psychiatric nurse practitioner or a physician's assistant who specializes in psych meds. So you may not need to go to one of those people if your primary care physician is willing to do that, but those are the people who prescribe medications: psychiatrists, psychiatric nurse practitioners, physician's assistants with specialties in psychiatry. A psychologist, on the other hand, which is what I am, traditionally focuses more on understanding human behavior. So a psychologist typically has a PhD or a PsyD. So a PhD is a doctor of philosophy, and a PsyD is a doctor of psychology. Traditionally, psychologists had PhDs because we were actually, somebody with a PhD in psychology is typically trained more to do research in the field of psychology and understanding human behavior, whereas the PsyD, or doctor of psychology, was developed as a sort of a practitioner model of psychology, where you were being trained to be in practice. But psychology has a number of different subdivisions. So I'm a clinical psychologist. There are also counseling psychologists, and then there are also experimental psychologists, industrial organizational psychologists. So there are all different kinds of psychologists. But the ones that tend to go into private practice are like clinical psychologists, counseling psychologists. And when they do go into practice, they're primarily focused on therapy and psychological testing, which is what I do. There are other roles that a psychologist serves related to consultation and things like that. But the big things, if they're going to go into private practice, is typically therapy or testing. And other similar providers who do therapy, not testing, that's pretty much reserved for psychologists for the most part. But other providers who do therapy might be counselors or social workers, or depending on your state, marriage and family therapists. But those fields, well, there is a doctoral level degree available in some of those fields, but most people who go into those fields have a master's level degree, whereas a PhD or a PsyD is by definition a doctoral degree. So the definition, or the difference between a psychiatrist and a psychologist, is that a psychiatrist is a medical doctor who prescribes medication, and a psychologist is a more of a behavioral still a doctor, but works with behavior and therapy and sometimes testing. Now, there is overlap between these two fields. So, the Diagnostic Statistical Manual of Mental Disorders, which is the kind of the manual that we use for all the diagnoses that we will, or all the disorders that we may diagnose, that's developed by the American Psychiatric Association. But both psychiatrists and psychologists can use that to diagnose people. Um, Also, there are some psychiatrists who are trained in therapeutic approaches and even testing approaches, and at that doctoral level, they can do those things. They don't typically have the same depth of training in those areas that a psychologist does, but depending on what it is, oftentimes they can get plenty good training to administer those interventions. Um, Also, some psychiatrists are trained as both MDs and PhDs. Usually, this is in the context of someone who's trained to do research, where they are getting they're getting training to be a medical doctor, but they also get a PhD that gives them extra training in how to conduct experiments and do research. So a lot of times they're not actually practicing at with their PhD, but theoretically they could. Um, then there are also some psychologists who can prescribe medication. Now, this requires that a psychologist go through a postdoctoral master's program or some kind of postdoctoral training in psychopharmacology, which is kind of a subspecialty. And then only in certain states, they can actually prescribe medication with that training. Right now, I think those states are New Mexico, Louisiana, Illinois, Iowa, Idaho, Colorado, and Utah. Um, that list is probably always expanding, but as of right now, if you're a psychologist with that additional training, you can prescribe medicine in one of those states. So that's some overlap, but in general, that's the difference between a psychiatrist and a psychologist. You got a medical doctor who prescribes medication. You've got a behavioral specialist who's a doctoral level, but really focuses more on therapy and testing. So I hope this has been a helpful clarification for those of you who may not know which direction you need to go. Keep an eye out here for more content on all things that are hopefully related to your needs and, kind of individual issues and societal systemic issues related to mental health challenges. All right. Thanks for checking us out.